I managed to smile, I think. We will see when it goes up. But I think I was smiling. Just check everyone here. Hi, Claire from Vulva Cancer. Just waiting for Emma. This today is about lichen sclerosus. I've done this one before, but this was a different lady because each lady's story takes a different path. And this is equally sort of, oof. So just waiting for Emma of Lichen Sclerosus UK to join me. Hi, Emma, if you could ask to join, please. Yep, there we go. Oh. Waiting for Lichen Sclerosus. Connecting. Hello.
Hiya, you okay?
Yeah, good. It's all working. How are you?
Yeah, not bad, thank you.
Don't be nervous. It's all fine. Just me and you. So I'm going to say a small bit like I do, and then it's over to you. But just saying, this is about lichen sclerosus, and any questions that you have, our Vulva Cancer UK is on there, and she can answer them for you, Claire, who I've done an interview myself with, and you can go and look back at her video also. So a quick bit about Emma. I have forgotten your age, though, Emma. Are you 31? I'm not going to say because it's wrong.
No, 37, unfortunately. I wish I was.
So I've known Emma nearly about 18 months, and she came to my house about 16 months ago to do a video about the similarities between vaginal atrophy and lichen sclerosus, of which there are quite a few similarities, but you know, vaginal atrophy takes one path and lichen sclerosus can really take a different path. But also the fact that we're both very eager to stop assuming that every sore, itch, irritation is thrush, and the same thing is for the GPs, because Emma is yet another person who at the age of 5 started having symptoms, and she will tell her own story, and it's been truly, it's just truly awful. Another one. And I'm allowed to mention, because Emma messaged me yesterday, so I did say to her we could cancel this today, but she's been having some more symptoms of a small sort of ulcer area, and she went to her doctor yesterday, and she's been put on the urgent 2-week referral for suspected vulvar cancer. And that's why we have to really be aware of these problems. So Emma runs a group along with Claire for lichen sclerosus. They've joined together. Claire's vulva cancer one as well, but they've joined up as a team. Two heads work better than one type thing, and they are doing a huge amount to raise awareness. So I'm going to hand it all over to you, Emma, to tell your story, and if there's anything I don't understand or interrupt, then I'm not being rude, I'm just sort of, you know, having a two-way conversation. So you go from the beginning.
Yeah, okay. So basically, yeah, I was about 5 years old when, I mean, I suppose my earliest memory is being 5 years old. I remember standing in a classroom and just this unbelievable pain to the point I was, you know, I was beside myself, crying. Really, it's probably about the only incident. There must have been more, but I've probably blocked them out, to be honest. I was never taken to a doctor, even that young, just to, you know, to have it investigated, see what was going on. So, you know, nothing was ever really done about it. And being that age, I didn't question it. So, really, the story kind of starts more sort of teenage years. So when I was at school, but obviously at that sort of age, a lot of my friends were, you know, becoming sexually active. I couldn't, because it just, you know, even if I tried, it was too painful. I couldn't do it. I couldn't go through with it. And so rather than, you know, say the embarrassing and saying, oh no, I'm still a virgin, I haven't done it, or, you know, for whatever reason, I just said, yeah, well, yeah, you know, I've done it. Of course I have, you know, it's fine. You know, don't worry about it. And even, I suppose, to a point, you know, even friends that would say, oh, you know, I'm thinking of, you know, doing it with this lad. And I'd be like, oh yeah, no, you'll be fine. Go on, you know, just go ahead. Because, you know, I just kind of wanted to
admit, say about it.
Yeah, so then, I mean, even then, I knew something was wrong, but I suppose I always put it down to the fact that it was just something in my head. And I thought, you know, if I go to the doctors, they're just going to say, oh, you know, it's in your head. You're not really at an age where you should be worrying about anything like that at the moment. You know, kind of get on with it. So I never went. And it wasn't really until sort of adult years, which is, you know, I got a boyfriend and we tried, and I couldn't do it. I couldn't go through with sex. It was just too
And
painful.
were you in pain all the time as well without sex? Was it painful to sit, wear trousers, pants, all the other things as well?
Yeah.
Yes. Burning,
Yeah.
sore, itchy, all the things.
Yeah, constant. For me, it was definitely a lot of burning, a lot of itching all the time. And it was the two together, I think, which was worse, you know.
Yeah.
And so I never, you know, treated it, or I just kind of lived with it privately, I think. Even my family didn't really know anything about it. And especially because I grew up with, you know, 4 brothers, we didn't really discuss anything like this. So, yeah, by the time I got to sort of 21, 22, I was in a relationship with somebody, it wasn't happening. And, you know, he was the one that kind of asked me why, you know, what's going on. And so I came clean and I said, you know, it's painful, it really hurts, I can't do it. You know, he was like, you know, well, you've tried relaxing, you've tried, and I was like, yes, I've tried it, but it's not happening, you know, it's too painful. And so he said, you know, go to the doctor, you need to get it looked at in case something is going on.
Yeah.
So instantly I did. I said, all right, fine, I'll go get it sorted. I mean, that relationship ended because, like most relationships, you know, if I couldn't have sex with them, it quite abruptly.
Yeah.
So I thought, yeah, okay, I'll go to the doctor. So I made the appointment and I did go to see the doctor. And he said, you know, he took a look, he did the examination, and he said, you know, I'm going to send you for a smear test. I don't think everything's as it should be. So yeah, so I booked in to see the nurse, and she did, well, she was going to do the smear test. But at that point, she kind of said to me, you know, were you abused as a child? Because of how my vulva looked. And at this point, I hadn't looked at it. I hadn't seen it.
No,
never. And so she said, you know, you're too small I can't even get the smallest speculum in, so I can't do the smear test. And I just remember, I walked home that day and I was fighting back the tears the whole time. And when I got back, I broke down in my room. I was on my own. Again, I didn't really even tell my family at the time that I'd even been to the doctors. And just the fact that, you know, somebody had asked me, had I been abused as a child? I thought, you know, why has she asked that? And at that point, that's when I got to go out and I had a look. And I could see exactly why she'd asked me, because there was a lot of bruising. There was a lot of the structure was missing. My clitoris had been buried. I'd lost inside my inner lips, the labias. And it just looked an absolute mess.
So had you been able to go to the toilet normally at this time and have periods? Was there anything different there, like going for a wee? Was that okay? Or would it always hurt you because of the skin and everything?
Yeah, no, it was always painful to go to the toilet.
Okay.
Always. I mean, I used to many times sit there and hold tissue paper over me to try and get me through going to the toilet, because I'd be in tears most of the time going to the toilet because the pain was just excruciating.
And this was as a teenager, obviously. Yeah.
Yeah. I mean, it's always been the case that, you know, going to the toilet was always one of the hardest things.
And what about periods then? Sanitary towels, I assume?
Yeah, I mean, I started my periods probably about 12, 13 years old. I mean, they've always been okay. You know, they're very hit and miss as to whether they're heavy or painful. But, you know, to me, I suppose that's quite normal for me. And I did try and use a tampon, actually, once. And I managed to get it inside. However, because it's so dry down there, I couldn't get it back out. And I started panicking and, of course, clenching even more. I couldn't do it, and so I never went back to using or trying ever again. Even to this day, I won't use them because of that experience. Again, the pain was just unbelievable. You know, trying to get this tampon back out, even trying to wet it, tried everything, but you know, it just wasn't happening at all.
So when you use sanitary towels each time, that must have been extremely sore externally as well.
Yeah, it does. Especially, you know, there's a lot of chafing going on as well, and you know, if there's inflammation there, it tends to swell a bit, so it does rub quite a bit actually. But then sometimes I will find that if I'm on a period, then if I'm actually in a flare-up, sometimes that can actually help, so it can actually ease the symptoms. And I don't know if that's because of the moisture, you know, making it less dry so it eases the symptoms. I'm not sure, but I do tend to find actually,
Okay.
you know, if I'm on a period, it can help sometimes.
Okay, all right. So carry on. So I just wanted to talk about the period side. Okay.
Yeah, no, it's fine. So yeah, so after the nurse, I then she said, you know, you need to go back to see the doctor. So I went back to see him. He said, you know, I really don't know what's going on, but something isn't right. So I'm going to refer you to the gynecology department at Northampton General. And actually, I was seen quite quickly by this consultant, and he was amazing. He had a look at it, and he said, you know, I think I know what's going on, but I'm going to need to biopsy it just to make sure and confirm. So he did, and within, you know, a few weeks, I got the diagnosis. It was lichen sclerosus. He printed off some information that was available at the time. There wasn't really a great deal of information back then, but yeah, he printed off some stuff. And of course, in that, they do mention that there's a risk of cancer. And it's the first thing a lot of people see, you know, when they Google lichen sclerosus, is that there's a cancer risk to it, and there is. And so he brought me back in for another biopsy, just to check that there was no pre-cancer cells going on or any changes happening. And thankfully that came back normal, it was fine. But because he didn't know enough about it, he couldn't treat me, and, you know, he couldn't really continue to have me as a patient so much. So he then referred me to the Hammersmith Hospital in London, where they had a consultant down there who was more of a specialist in lichen sclerosus. So for quite a few months I went down there, you know, had these appointments. But really, yeah, that's kind of where my story takes a bit of a dramatic twist,
So it's
shall I say.
horrid.
Yeah, so the two clinicians who work with the consultant down there decided that actually they wanted to start a dilator treatment. So they were going to admit me for 3 days to start this treatment. And obviously the dilators sort of come in 8 different sizes, starting from quite small to, you know, pretty large, really. I'd never really heard of them before, didn't really know what was going on. There wasn't really a lot explained. And so I went in on the first day that they admitted me, and one of the ladies, in fact the lady who kept coming in to do the dilator treatment, she was brutal, because at no point did she ever allow me to insert them or give me the option to insert them myself. And when you think back to the smear test, you know, the smallest speculum wouldn't even fit in. So, you know, and so on the first day, yes, she came in and she inserted the first size. Now that alone made me bleed, it made me tear, and painful just even to go to the toilet after the first one. But then she came back a couple of hours later, with the second size. And I was like, okay, what are you doing? The first one really hurt. You know, why are we doing the second one? And she was like, well, no, this is quite standard, actually. You need to make sure that we can stretch your vaginal opening. And I was like, right, okay, that's fine. You know, if that's what you've got to do. So she did the second one, which obviously then tore me even more. So I became a lot more painful. And then again, you know, even later on that day, she came back with the third size. So by the time the third size was done, that was it. I could barely stand, I could barely walk, I could barely sit, I couldn't do anything. And it was just absolutely horrific.
Was she remotely compassionate? Was there any compassion or anything?
No, there was no compassion at all. It was, you know, when I said, you know, I'm bleeding, I mean, I could see blood on the dilators. She could see it on the dilators. You know, she could see what was going on. But no, there was no compassion at all. She was just, you know, it's what we've got to do to get to where you know, to be able to have a normal, healthy sex life.
That's all they're paranoid about, is sex life.
Yeah,
and you actually tore. I mean, that's what you actually tore your was it your perineum, the opening?
My perineum tore. Yeah, around my clitoris tore. I had really bad burning on my labias. And again, you know, even when I went to the toilet that day, even after the third one, I was back to where I was when I was a teenager and a lot younger, where I was having to hold tissue against my vulva to try and urinate to get it out. But even then, it took me, you know, sort of an hour, or even over an hour, for the rest of the duration, actually, and long after. So yeah, basically that was kind of the first day, and then on the second day, she came back in with a size 3 again. So there wasn't even a, you know, we'll start from scratch, we'll go back to size 1 because of what happened yesterday. It was, we carry on where we left off. So she then went on to size 3. A couple of hours later, came back with size 4, did that one as well. So by this point, you know, she when she came back with a size 5, was like, no, I can't do it anymore. You know, it's got to stop. I can't take it anymore. There was no sympathy at all from her. She was quite willing to carry on to probably size 8 the next day. And it was at that point that I decided, you know, I think I rang my mum up and I spoke to her and I said, you know, what was going on? She was like, no, you've got to tell somebody. You've got to tell your consultant at least. So I did. I rang my consultant back up in Northampton. I was like, look, I'm in agony. You've got to get them to stop because, you know, and I explained exactly what happened. He said, you know, why aren't you doing it? And I said, they're not giving me the option to do it. They are forcing me to do it. You know, she is forcing them inside me.
Yeah.
I have no control over this. And he was furious, absolutely furious with it. He said, no, you know, if she comes back into that room, you tell her, no, you refuse the treatment. It's not happening anymore. And about an hour after that, the woman who was doing it, she came back in and she said, right, we're discharging you. And I apologise for, you know, for the way I've treated you during the treatment. And that was it really. I never went back to that hospital again because of that experience. You know, I lost all faith in them. Yeah. And as I say, I didn't really understand until my consultant had said to me, no, this isn't the way it's done. You start with the first size, you gradually, over a long period of time, you work up until, you know, you don't go to the next size until you're comfortable going
and what
to
you have to remember is, you know, you're a young woman, and back even 10, 15 years ago, we did what we were told by the medical staff, because you know, you've got your legs in stirrups, I assume, weren't you? So you're sort of in a very, you know, horrible position, and you're in pain. And I don't understand how they can carry on doing that. I just don't understand it. And this is why it's so important that, you know, carry on how you've changed that. But what is scary, that this consultant is still out there.
Yeah. I looked into her the other day, and yes, she doesn't work for that hospital anymore. She works somewhere else, but she's now a consultant, which I think is even worse. So she's been promoted. Yep. You know, she used to work under a consultant. Yeah. I mean, there's notes on it. It says, you know, her rule now is that people can have some, you know, a friend or family member go in with them, and I'm not surprised. Yeah. Because she knows she could have ended up with a massive lawsuit. What she did was wrong. Yeah. You know, so
you were assaulted. Yeah, you were assaulted, basically. You know, that is a type of assault.
Yeah, absolutely was. It was. I mean, it was like being violated, really, when I look back now. But I suppose the trauma at the time, I couldn't fully comprehend what had happened. Oh. You know, because I was in a lot of shock. And it wasn't actually until some years later when I spoke to my best friend after I'd got postnatal depression. I met my best friend through a group that I was attending. And she'd been to the gynae clinic and had the same consultant as me. And, you know, I told her my story of what happened. She said, oh my God, actually, you're the girl that they told me about. And I was like, well, what do you mean they told you about me? She said, because I was starting dilator treatment. She had a different condition to me. But she said, you know, they told me about what happened to you. And they said to me, don't ever let anybody insert them. That is not the correct procedure. You have to do it yourself. You have to be in full control of it. And so from that, I learned that actually they were using my experience to educate other women on how to correctly use dilators, so that this was never repeated, never happened again.
Yeah, well done for that. Horrendous that you had to go through it, and obviously women before you should have done the same before, who would have probably put up with it, especially if a very young person or an older person where you don't have a voice so much, you just sort of, you know, and well done. And it's harrowing, and it makes me spit feathers, all this, because we know this sort of treatment, maybe not that one specifically, but is still going on. Women are just, their gynae health is not good, how we are treated. I think it's whether it's because we assumed we can have babies potentially, and your vagina opens up and anything can go out of it, anything can come in it, you know, and it's just, you're on a production line. But that's what these videos are about. We have to change. This has to change. And I hope that lady who's a consultant now knows what you are doing with Claire to raise awareness, because you deserve a huge pat on your back.
Thank you. But yeah, she's yeah, I mean, I suppose even now thinking back to it, actually, you know, she used to tell me that I was the second youngest person in the UK to be diagnosed with lichen sclerosus. Now, the person before me, who had also done the dialectic treatment, apparently she went on to have a full healthy sex life. And that was the promise to me, that I would be able to go on and have a full healthy sex life, and that I wouldn't be in pain anymore. You know, sex would never be difficult again. And that was the whole reason for her doing it. But, you know, the way she did it and the way she conducted herself was just disgusting.
Mm-hmm.
You know, nobody should have to go through that at all.
And just before you go on to the next stage, once she'd done all that and you said no more, your consultant at Northampton said no more, done. How did you get home? I mean, you must have been in agony.
Yeah, I was. I had to get on a train and travel back to Northampton. And I mean, I was on my own as well. And yeah, probably numerous times even on the train, I think I almost broke down in tears. And, you know, I couldn't move, I could barely walk. It took a long time to get back,
Yeah.
you know, and my head mentally it just wasn't in a place to be thinking, you know, how do I get back from London, a place that I don't really know, you know, back to a train station, back to Northampton again. So yeah, it had a massive impact on my mental health.
Absolutely. Yeah. I mean, all these stories that I hear, I just feel so bad for you all. It makes me, each one makes me crosser and crosser. And we just, yeah. And well, you know, and you're sitting there probably now really uncomfortable with, you know, with what you've got, you know, this new ulcer and that, and you just keep going. So yeah, I hat off to you. So if you go on to the next part.
Yeah, so after that, I then went to, I went back to my consultant, and he said, you know, I've got somebody in Northampton General. She's gynecology, oncology. She doesn't really know a lot about lichen sclerosus, but, you know, she probably knows enough that she could help you. And I said, it's fine, you know, as long as the same's not going to happen. He said, I promise you, the same is not going to happen again. I said, okay, that's fine then. So I was referred to another gynecologist. And I have to say she was fab. She was very experimental because she didn't know enough about it. So she ended up doing 3 clitoral hood separations to try and unbury my clitoris. They didn't really last that long. I probably had that once a year because the effects just took hold again so quickly after doing it. But then she decided she wanted to try a skin graft. So basically they decided that her and a plastic surgeon would actually take some skin from my groin area and attach it to my vulva, and just see if the lichen sclerosus would still affect that skin as well, with it coming from a different area of the body. And then again, they did a second one, and they took that from the abdomen because actually the first one from the groin became extremely infected on my groin. I didn't realise at the time I had another skin condition called, I think it's pronounced hidradenitis suppurativa, which causes abscesses on my groin. So I think that could be a cause of why the groin didn't take at all. But actually, after doing those, you know, I didn't need any further operations. So they were more successful. So I was quite glad that she did try them, actually. And from there on in, even when she was doing the operations, actually, she did the smear tests for me because I could never have the smear test still. It was still too painful. And it was through her doing the smear test that I realised I had pre-cancer cells on my cervix. And then also, so she saw me on my vaginal wall as well, which was stage 3 pre-cancer cells. So then it was more surgery and the loop excision even for that. And that went on for about 3 years as well. So trying to deal with the lichen sclerosus, and then, you know, feeling like you'd come so close to having cancer. And the only reason she'd noticed the cells on the vaginal wall was by accident. You know, she openly admitted, she said, I literally found them by accident. Because they don't check, you know, when they do a smear test, they're checking the cervix and nothing else.
No, because that's it. When you, I mean, this is going slightly off piece, but when women have their cervix removed, have a full hysterectomy, and then they have no more smear tests, but you can still have things going on in the actual vaginal vault, and that's not checked for, and it should still have that checked for on a however long basis, because you can have cancer cells going on in the vagina just because the cervix isn't there.
That's it. And I mean, you know, I dread to think now, if they hadn't caught it, what position I would have been in, you know, had it turned to cancer.
Do they think it's all linked then? Do they think the whole thing was linked?
Well, I do think VIN is quite linked to lichen sclerosus. A lot of lichen sclerosus sufferers do tend to have VIN cells as well, which can recur. They can keep coming back.
Okay.
So it is really important that, you know, when you go for your smears or when you go for any assessments, to ask them to check for the VIN cells as well.
Yeah.
Because you know they're silent. You don't know that they're
So
even
where do they
there.
check for the VIN cells? In where do they actually check for the VIN cells?
The VIN cells, as I say, that was actually picked up on a colposcopy.
Okay.
So when she did
Yeah.
colposcopy on me, that was when she noticed that actually the vaginal wall didn't look as it should.
Okay.
So yeah, she took me into surgery for that one, removed those. I think she did another loop excision, so I had 2 loop excisions for the cervix.
And that's where
And
they
then,
take off, do they bite bits off of it, take off areas?
yeah, it's like a little loop machine. So they literally kind of, I believe they kind of burn them off with this loop. So I mean that's quite uncomfortable and quite painful as well on its own.
Yeah, I know, we have to have all these procedures while we just awake in
Yeah,
the most delicate areas of our body. I mean, the vulva is one mass of nerves, and the cervix itself is all. And I don't know why we're expected to keep going on and having these things. I mean,
no,
a GA. I think a lot of women warrant to have a GA for a lot of these things, and not. I know they say that general anaesthetic, you've got effects with that, but they are very, very good these days, general anaesthetics. And I think some of the things that we have to go through, perhaps have a paracetamol, you know, to help your pain, is a load of nonsense.
yeah, absolutely. There's so many creams and things like that that can help, and
Yeah.
you know, even people that are having smear tests, you know, a lot of them aren't even offered some sort of anaesthetic gel or something just to take the pressure off, especially when you've got a skin condition
Yeah.
that, you know, can make you tear.
Yeah.
You know, it's scary, really.
Yeah. Yeah. Okay. So yeah, carry on. Yeah.
Yeah. So once those cells were removed, actually, there wasn't. It was just really going back for sort of checkups, as opposed to anything else. Just making sure that it wasn't going precancerous. So I've had quite a lot of biopsies over the years, just to check that, you know, nothing more sinister was going on. And really from there, I suppose, the next point in my journey was really when I fell pregnant with my daughter, because
That's
it
a
was something I
miracle.
never thought
That's a
would happen.
miracle in itself, that you managed to
That's
have
it. Yeah.
intercourse. Yeah.
Yeah, that's it. And it was only really through the dilated treatment that I was able to do that,
Yeah.
but not because of what the hospital had done to me, because I managed to do it myself and managed to get myself up to a point.
Yeah.
So yes, eventually I was able to have intercourse. It still hurts, you know, a lot. Even now, having intercourse hurts still. But the fact that I never thought I would have my daughter, just was heartbreaking, I think. And even actually before I had her, I did fall pregnant again before I had her.
Okay.
And that ended in a
Oh,
miscarriage,
sorry.
which was quite traumatic. I ended up in hospital in full-blown labour, and for a long time afterwards I thought it was because of the lichen sclerosus. I thought, you know, that's it, I'm done. I can't clearly carry a child. But then my daughter came along, and actually the pregnancy went really well.
Yeah.
So it turns out that the miscarriage wasn't to do with the lichen sclerosus after all.
Yeah.
And I don't know what caused it, but
Okay.
yeah, she was. It was a healthy pregnancy. I was referred back to the same consultant actually who diagnosed me, and he said, you know, because of the severe changes that's going on, because of the scarring, and he wasn't sure that actually having a vaginal birth would be the way forward. He was what any tearing, you know, could do to me, what it could do to the baby. So actually, he booked me in for a cesarean. So yeah, she was born via a cesarean. She decided to come 2 days earlier than that. Yeah. We do sometimes, but yeah, it was an emergency cesarean, and arrived safely. And obviously, with her being a girl, we don't really know what the genetic link is. No. So it is constantly having to check her as well to make sure she's not displaying any symptoms.
Yeah. Okay. And while you were pregnant, did your lichen sclerosus flare up, or did it calm down, or just stayed the same?
Actually, it calmed down. I didn't have a flare up throughout my whole pregnancy.
Right. But there
So,
must be a
I
hormonal link
mean,
somewhere, do you think, as well as everything
yeah,
else?
it is. Yeah, I think between, it's with all the years experience I've got between the periods and the pregnancy, yeah, I think there's a massive hormonal link between lichen sclerosus and hormones, really.
Yeah, yeah.
Um, it's just a shame there's not many people that want to actually put some research into it to find out exactly what is causing it and what, exactly which
Yeah,
hormones,
because we
responsible.
that's right, and we do believe. I mean, I only know a very small snippet about lichen sclerosus because I was misdiagnosed myself for a month. But you see on Twitter these a few doctors who do talk about it, and one I think it's a dermatologist who talks about it, who says lichen sclerosus isn't rare; it's just not diagnosed; it's just missed. And is that what you would say?
Yeah, yeah, absolutely. Many women that we speak to through the awareness will come to us and say, I'm constantly getting, thrush treatment, or being told I've got thrush all
Yeah,
the time. But the
yeah,
treatments, they help a bit with the symptoms, but then it comes back again.
yeah.
And we'll use them. So many patients with LS actually are being misdiagnosed and being told they've got thrush time and time again, and it's not thrush
No, and it
because
can
the
be for
symptoms.
that's right. For years and years, and some of these women, which is why we are saying stop self-treating. If you think you've got thrush, or a doctor says you have thrush, you need to have a swab. You need it confirming, because that's what the three vulva dermatologists I've heard talk have said. By the time women get to them, it's normally too late with that itch or sort. No, not too late, but it's very advanced with whatever, with that itch and soreness. But they've never had any of them test positive for thrush, but they've been treated for thrush for years and years, and it was another skin condition. And
Yeah,
and your group especially, because obviously yours is lichen sclerosus, but my group as well, because I keep mentioning if your vaginal atrophy isn't getting better, blah blah blah. Look at so many of them are coming back with I've got lichen sclerosus. I've got and then with menopause, or women post-menopause, peri, you can have both. You can have lichen sclerosus and vaginal atrophy. The two quite often come together. So we need to really, somehow get the momentum getting bigger and bigger, because thrush, I'm sick of the word thrush.
yeah, this is it. And you see so many products as well advertised on TV and say, if you've got a vaginal itch, use this cream and it'll take it away. And it's like, no,
No,
you scream at the telly. No, it doesn't.
no.
Because you don't, these people have thrush. You don't know what's causing that
Yeah,
itch.
yeah.
You cannot do every itch.
It's
Some cream is going to take,
no, and
it's a lot.
yeah, that's right. And there's many skin conditions. There are, I think of all the ones, there's a lot that I was surprised about. I can't remember any of the other names because some of them are huge things. But there are there are a lot. And these adverts, I think they're actually quite dangerous, because yes, these creams and these creams you can buy over the counter might take that itch away, because they actually do have ingredients in it that can take that itch away. And that includes the thrush ones, because the dermatologist said to me that women use the thrush cream, their symptoms go for a few days. So they think, I had thrush. No, not necessarily whatsoever. There's just an ingredient in there that take that symptom away. You could have had another condition that might have been flaring at that time, and it's doing this. So we shouldn't. I think they are actually quite something that should be behind the counter, properly behind the counter, and discussed with a pharmacist properly.
Yeah, exactly. I mean, this is kind of why we do the checklists as well. Obviously we've got checklists for lichen sclerosus and even vaginal atrophy, vulvar cancer, and we've started doing a lot more for a lot more vulvar conditions as well, including even lichen planus, which a lot of women who have lichen sclerosus also get diagnosed with lichen planus as well, because the two are so similar. And you just think, why are these pharmacists, why are people not using checklists to make sure, find out how long has this been going on, what treatments have you tried before,
Yeah,
is it working, why is it not working?
absolutely. And people ring up, I'm amazed, there are amazing doctors out there. Well, I'm not slagging off doctors before I get but they have some amazing x-ray eyes, is all I can say. You go in with that itch, they don't have a look, here's your thrush cream.
Yeah,
it doesn't,
yeah,
and there was a big conversation on Twitter the other day, I think Claire was part of it, where there's a load of from America talking about the vulva and examining, and they said, end of story, you check. There was no discussion. And you've got all these MDs, they're called out there, medical doctors, all saying, yes, 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 we check every other part of the body, but for some reason the vulva gets ignored. And we as women, we might not like being examined. You know, I don't, and the world's seen mine, it feels like now. It's probably the world has seen yours.
Yeah.
But we're going to have to say, I'm not leaving here until I'm looked at. And if you're not happy
exactly.
and if you're not happy with the person who has looked at you, you then ask to be referred on.
Yeah, this is it. I mean, the thing is, I mean, I can't necessarily sit here and slag off all doctors.
No.
I've had a one consultant who's really helped me, and an amazing team for the majority. But actually, you know, when you look into it, there's a lot of doctors that won't say the words, you know, vulva or vagina. You know, that's down there, or, you know, or the other part. Or don't, you know, refer it to something else. And the trouble is,
that's right, number 1 hole or number 2 hole. I've even heard of a doctor say, not to me, but someone else. I'm thinking, my God.
I mean, it's absolutely crazy the amount of different words there are for it. It's confusing. You know, it's quite simple. You know, the vulva's outside, the vagina's inside. Use them, because until people start using those words, and especially doctors and nurses, you know, the stigma around this and people talking about it isn't going to change at all.
No, and it's ultimately going to come from the patients. That's how change does happen.
Yeah, exactly. This is it.
You know, groups like us, like you, and we just try and make our small mark and make noise, because there are so many of these hidden conditions. Because you look well, you look fine, you know, everyone who I've done these talks with look well and fine, but you're actually in blinking agony. And when you put all these women with their vulva conditions, bladder conditions, vagina problems, pelvic floor conditions, all under one umbrella around the world, there are tens of millions of women suffering all the time, day in, day out. And this area just seems to be like no man's land and is ignored. No one wants to go near it. This is it.
I mean, to be honest, we've started doing sort of cartoon images now, where we show people what it's like to, you know, tell somebody that you've got a condition on your vulva. And generally the response we get, because a lot of people are kind of like, oh, no, hang on a minute, I don't want to hear that, I don't want to talk about that. Or is it an STI? Have you got HIV? You know, we get all sorts.
Yes.
And funny enough, I mean, we did do one on vulvar cancer the other day, and the fact that, you know, a lot of people, even with vulvar cancer, are, you know, kind of almost feel like they have to hide it. They have to say, you know, what people assume even that it's cervical cancer or it's a cancer somewhere else. And actually, there was a doctor that she kind of shared it, and she was like, well, you know, why don't you just say it's a gynecology skin cancer, because that's what it is. And I was like, but hang on a minute, why should people have to?
Yeah,
why should people have to say that it's a gynecology skin cancer? You know, the correct word for it, it's vulvar cancer or it's vaginal cancer.
Yes.
You know, why should people have to hide what it is because it's a taboo subject?
Yeah,
you know, it shouldn't be taboo.
Yeah.
So
I mean, absolutely. So where are you at now then, Claire? Because we've gone. You had your baby. I won't say her name. And you had, then after the birth, you got bad postnatal depression, didn't you?
I did, yes. I think probably a lot of it stemmed from probably even the mental effect that the LS had on me all the years, and the fact that I was so convinced that the lichen sclerosus was the cause of my previous miscarriage, that actually I couldn't really get into the pregnancy. I was constantly concerned and worried that something bad was going to happen. Yes. So I didn't want to become attached at all. And so, yeah, I think that became the postnatal depression afterwards, after she was born.
And did you get help? Did you get medical help?
I did, yes. But I mean, again, midwives and health visitors, they all missed it. You know, they didn't ask me any questions really. So it literally got me to get to a point where she said, you know, well, I said to myself, sorry, that, you know, I've got to get this looked at. I can't raise a baby on my own because I wasn't with the father. Whilst I'm feeling this way, and if it comes to a point, and I was petrified that actually she was going to be took away from me, but I thought, you know, it's at a point now where if that's the option, then that's the option.
So you were obviously, were you in a dreadful place? It sounds like then, if you were thinking that if you didn't get better, she might be taken away.
Yeah, I think I was literally on my knees by that point. I just feel like I couldn't carry on any further. I think I've given up the will to live, I think, almost by that point as well. which is scary when you've got a newborn baby. Actually, you know, I think when I came to the realization that actually, you know, if they decide that she needs to be taken away from me, then maybe that's for the best. And I almost convinced myself that that probably was going to be for the best. But actually, they weren't. I mean, they didn't judge me at all. And you know, I attended some wellbeing classes, helped me, you know, realise why I was going through it, and what I was feeling was actually quite normal for a lot of people. And so, yeah, with the correct treatment and the correct counselling, I managed to get over it. And well, I say get over it. I think there's always maybe that underlying, you know, is, you know, if you have a bit of a temper outburst when they push you too far, you're kind of thinking, oh, is this me overreacting again? Is this something to do with it? But I mean, generally speaking, she's really happy. You know, I'm happy, and we're in a good.
Oh, that's good. You know, you're in a better place. So now you're on. We've got to your new consultant put you on an open appointment basis.
Yes, so my old consultant, my experimental one, as I call her, she left. She went back to Singapore and had a new consultant take over. I mean, I remember talking to him about the hormones and saying, you know, is it worth me being tested to see if hormones are related to this, and what hormones, and if there's treatments that can help it? And he always said, you know, it's not worth doing it, because you know, if you're put on treatment for hormones, then it's actually going to outweigh any good that the steroid will do for the lichen sclerosus. And so we never entertained the idea anyway. And he also said, you know, basically you're here at this appointment because we need to make sure that you're, you know, it's not developing into cancer. That's why you're here. And it got to a point where, because I've been stuck for so long, he said, you know what, you haven't had surgery for so many years. I'm going to put you on an open appointment. He said, no, that basically means that, you know, if you get symptoms that you think need more attention, bring up and we'll get you back in. And I was like, all right, fine, you know, if that's what you want to do, that's okay. And I think it was about a year or so afterwards, and I suddenly was like, I've got a swelling on my Bartholin's gland that isn't going down. And so I rang them up and said, you know, because it's on the vulva, I would feel better if he checked it out, just to make sure there's nothing more sinister going on. And she said, oh, I'm sorry, you've been discharged. I was like, what? You've been discharged? No, I was put on an open appointment system, which means I can ring up when I need an appointment. And she said, no, actually, that only lasts for 6 months. Unfortunately, with quite a few patients where he hasn't realised that that's what it means. So unfortunately, you're going to go back to your doctor and be re-referred. My doctor did look at it and he said, you know, I don't think it's anything sinister. I think you're okay, but, you know, so we'll leave it for now. But if you become concerned, come back and see us. So I haven't seen my consultant for a few years now, actually.
And
I've been left.
You should be under the care every year. At least I thought, you know, you ladies, but it's not the case, is it? I just thought you saw a consultant every year, 6 months to 12 monthly, but no.
Yeah, I mean, I think we're supposed to. I was told, actually, when I went to see the gynecology, the lady at the hospital, she said to me, you know, this is a condition that is for life. There's no cure for it, therefore you are going to be under my consultation for the rest of your life. I distinctly remember her saying it. And I came to terms with that. I was fine with it. But, you know, at least they're checking it. It's okay. But then, I mean, I don't know what's happened between then and now, because consultants now seem to kind of go, well, you know what, you haven't had surgery on it. There's not really anything going on. I think you can just, you know, go keep an eye on it yourself. And we're not medical professionals. We don't know what we're looking for.
We can't, in the distance between looking. They have magnifying things, don't they? Yeah.
I mean, they've done all the training in it, so they know what changes to look for. Which is why, you know, I mean, for me personally, it's kind of why I push people now to try and say, you know, check your vulva, check for these symptoms. I try and get people to know, both me and Claire do it actually, you know, make sure you know the symptoms of vulvar cancer, make sure you know the symptoms of lichen sclerosus or vaginal atrophy. And if it's not right, if there's a change, get straight back in and see them. Because a lot of women don't know to do that. They don't know what they're looking for, unfortunately, because they don't have the medical training that they have. And so it is really left to people like us to, you know, to say to people, it is vitally important to check yourself regularly, and make sure you report any changes, get an appointment. Even now, I think during, with COVID-19 going on, actually, with my story yesterday, I knew that this sore spot wasn't healing, it's not responding to treatment, so therefore I got an appointment, and they have referred me. So referrals are still going on. If they suspect cancer, you can still be referred, and so we are actively encouraging people to still go see their doctors. It's not just a case of go there if you've got COVID-19 symptoms, or ring them up if you've got COVID-19 symptoms. If you have a genuine health problem, they're still there for us.
Yes, yeah. Some of them are hiding behind it, though, from some of the ladies in my group, definitely. But yes, you can. Yeah. And what I just wanted to mention also is that the youngest person in the child with it in the UK with it, and also the fact that men can get it, but it's not as common, blah, blah. So if you could just give an overview of what lichen sclerosus is, and then a little bit about the VIN, and a little bit about, is it to do with HPV as well? A little bit, is there?
Yeah, the vulvar cancer is the HPV. So basically, with lichen sclerosus, the youngest child, well, the youngest person we know that has been diagnosed with it is a 2-year-old. With the fact we know that there's been a lot of children actually diagnosed with it, we did set up a support group for parents who, hope to give them a place that they could go and discuss things. And there are a lot of children that are being diagnosed with it. There is some evidence to say that actually when they go through puberty, it could disappear, but for a lot of them, it probably doesn't. What it probably does once the hormones kick in is probably goes into remission quite a few years, and therefore they probably may not get symptoms again until teenage or adulthood. So we don't fully know if that's true, if it does go away. Obviously with men as well, yes, there's a lot of men that do get it as well. It's not as common as it is in women, but they tend to get it on the end of their penis. A lot of them probably go down the route of having a circumcision. I think for some it works, for some it doesn't, but they still need a steroid treatment, and that can still also lead to penile cancer as well. So it's, even for those, it's very vitally important that they keep checking as well. With the VIN, we're not, I don't know the exact link, but I do know that a lot of women with lichen sclerosus do get the VIN cells. And the VIN tends to happen on the vulva, the external parts, with the lichen sclerosus. So actually it can be really hard to pick up. If you've got symptoms, or if you're having a flare-up with the lichen sclerosus, it may be hard to.
It's why you need a real specialist, isn't it? You need a real specialist. It's beyond the GP. They need the vulvoscopy and the whole equipment, don't they, to have a proper. I've had a vulvoscopy where they put that stuff on. They have about 10 seconds to count all the cells, don't they? It's like vinegar. It's not vinegar literally, but it's it's pretty.
Yeah,
it's an astringent thing that makes it all go and come out. But also the fact that lichen sclerosus can be on other parts of the body, can't it?
It can, it can affect people sort of anywhere in the body. I think generally it's kind of legs, arms and breasts, but more commonly it is the vulva area, and even the anus, which is why they say about the figure of 8. So it's sort of kind of around the top part and then comes down around the anus as well, which makes the figure of 8. So, a lot of people probably might not even have the symptoms on their vulva, but they could have it around their anus. Yes. I've had people messing with that as well.
And also a little myth, I just remember, because suddenly the clock starts going before we realise it, is that everyone assumes, and I know it is generally the case that you have the white, the whitening, but there are quite a few ladies in my group who haven't got the whiteness at all, but they pushed and pushed for a biopsy because they're just red and raw and sore and just not getting any better. And they push, and a number of those have actually got lichen sclerosus without the actual white. Now I know that's not a common thing, but so you still can't ignore your symptoms, can you, if you don't have the white?
No, this is the thing with lichen sclerosus. You may only have one symptom. You may only have the itch, or you may only have burning, or you may only have the white patches. Equally, you could have 2, 3, 4 different symptoms, So it's always important that if you've got an itch and it's persisting, it's not going away, to go and get it looked at. I mean, as we know, even lichen sclerosus, vaginal atrophy are very, very similar in their symptoms. But, you know, I think without a biopsy, it'd be quite hard to tell which it is, you know, if it's the lichen sclerosus and needs the steroid, or if it's the vaginal atrophy and needs the estrogen cream. So, yeah, anybody that has persistent symptoms, even if it's just one symptom, they need to go and get it looked at, especially if, you know, thrush and you know, the thrush cream isn't working.
And also the ladies in, because Claire's group and Emma's is about lichen sclerosus, mine is vaginal atrophy, but we're both in each other's and we sort of swap information across and try and help. But, you know, a reasonably high amount of the ladies who come into my group, and then I say to them, have you tried local estrogen as well? Because this is a menopausal group, but peri and postmenopause, and I would say a very high percentage, probably up in the 80s, if not nearly 90s, of those who then get the estrogen cream as well have a remarkable improvement in their symptoms, because, as I said, you can have both. It's not necessarily sorting the lichen sclerosus out, because that's got the potent steroid. It's the other part, which is the vaginal atrophy. So putting the two together, if you get a consultant who realises you can have both together, because they don't all, can, you know, make a huge difference. And as you've said, Claire, lichen sclerosus and lichen planus and vaginal atrophy, these conditions are for life. Treatment, the steroid treatment, if you want to talk about that, is not to be scared of. It's really important, because it may go into remission, but you come down to a maintenance dose, don't you? You start off high and then you do this tearing down. So if you want to say about that.
It's you start off, they recommend probably once or twice a day, and do that for a month, and then taper down to every other day. Do that for another month, and then go down to a maintenance dose, what they call a maintenance dose of twice a week. And that is continuous. So you keep on with that, even if you've got no symptoms. If you think it's gone away, it doesn't matter. You continue with that twice a week, because there has been studies done, especially in Australia, where they did show that actually using the steroid can help prevent the vulvar cancer developing from the lichen sclerosus. You know, a lot of medical professionals even still say, you know, once you've got down to, or the symptoms are under control, stop using the steroid. It thins the skin. It doesn't. The steroid actually reverses the thinning that the sclerosis causes. So therefore, by continuing to use it twice a week, you're not thinning the skin at all. You're helping, you know, prevent anything more sinister, like the vulvar cancer developing.
And that's why you know, a lot of medics aren't up to date. So unless they choose to get up to date, you know, if you've been if you were trained, I don't know, 10, 20 years ago, and your head and your training is still 10, 20 years ago, because it's not, I mean, it's, you know, I don't know, about 100 years ago, 150, I think, it was considered an STI, wasn't it? Sexually transmitted disease, lichen sclerosus. So it's not, you know, you know, you have to keep up with the latest knowledge, and it is obvious. Like the people with estrogen, they'll use estrogen for 3 months, and their GP says, "Oh, stop." You don't suddenly start making estrogen again, peeps. You know, you carry on watering your plant in the garden. If you don't water it, it dries up, and it takes longer to water it again. So you just keep up with these doses, and don't be scared of your steroid cream, because it's really really important. And you use emollients, don't you? What's that word?
Yeah, emollients. Yeah, so we use I mean, I use dermal cream to moisturise and wash with, because they obviously, with lichen sclerosus, a big irritant for it is soap products. So you know, if you've got it, or you think you've got it, stop using soap. And you shouldn't be using soap on the vulva or vaginal area anyway. No. So you know, we use the moisturiser to wash with in the bath or the shower. Use it to moisturise with as well, and actually that helps keep it a bit more supple. It stops it from drying out so much. But then also we do say to people, you know, use a local estrogen, or get a prescription for a local estrogen cream as well, because that will then help with the elasticity around the vaginal opening. It should help prevent sort of tearing around the perineum during intercourse. So yeah, we highly recommend people use the emollient creams. There's quite a few different ones, as long as it's a zero-based emollient cream.
Because there's a lot of natural therapies out there. This is a condition that doesn't go for natural, okay? yes, it is rare.
Yeah.
It's very rare, but you can get vulvar cancer. This condition needs to be taken seriously and looked after properly for the, you know, the rest of your life. And you know, a good diet is all good, and it may help reduce inflammation and all those things, but this needs medical attention for life.
Yeah, I mean, I think the scary thing at the moment is a lot of people using
Yeah, I was going
borax
to say,
because
yeah,
to find something that works, but actually borax is a poison. You know, why would you put it on there? It's the equivalent to probably, you know, bathing in bleach.
yeah.
But I think people are just so desperate for an answer that actually they're trying anything. So, you know, we're having to strongly recommend people, you know, no matter what you hear about this, don't do it.
Yeah.
And in fact, actually, I've had somebody who we know stopped the steroid, was using borax, and is in the process of probably being diagnosed with vulvar cancer. So borax, it doesn't stop vulvar cancer developing, and that's proof of it.
Yeah.
You know,
Yeah.
it's scary the lengths people go to.
And also you and Claire, so the Eve appeal is a big appeal, isn't it? The 5 gynecological cancers, because a lot of people don't even realise we have 5. So we have number 1, endometrial, we then have ovarian, we then have cervical. So people think of cervical as the top one. But
Yeah,
we then have
actually,
vaginal cancer, and sorry, no, we have vulva next, and then vaginal, don't we? In how sort of common they are. And the Eve appeal. So you say what the Eve appeal do, and then people can look it up, and because they're trying to raise money, aren't you, for the vulva cancer research?
yes, so well, through a lot of badgering, I think, from me and Claire and probably some other people as well, they've actually, yes, they've set up a vulva cancer, dedicated vulva cancer research. And so they're asking for donations to that research product. And then what they're actually going to do is they're going to let people pitch their ideas of what they can do to research the vulva cancer, and basically they're going to pick, you know, which one's going to be more beneficial to look into. So they're doing a brilliant job at the moment for all the cancers. And not only that, they've got a really good dedicated nursing team as well. And so they're there constantly for support. If you think you've got it, or if you've been diagnosed with a gynae cancer, you can ring them up and speak to them.
Yeah, yeah.
So they're a very, very good cancer charity to get in touch with.
And I do believe, I think I'm right through you and Claire, there's leaflets now, or something's happened where GPs, they can look online, can't they, about the...
Yes, they've got a training program as well for GPs and nurses, which they've now rolled out. Actually, I think the links to it are even on our websites as well, and they'll be on the Eve Appeal websites. So, you know, if there's any medical professionals watching at all and you don't really know much about it, you know, go on and have a look at that training program, because it is so beneficial.
Because Emma and Claire have also put a leaflet together that you can download off of their website. It can be a leaflet and folded into 3, or it can be put a poster and put on toilet doors. Yeah, all those sorts of things. So if you print some of those off, take them to your doctor, give them to your local nurse, take them where women go, put them on the back of the door in a loo, and all these things to raise awareness of all these things. And what is most important that both of us will say is that examine yourself, you know, once a month. I mean, if you have lichen sclerosus and these other conditions, I believe it's weekly. But you know, if you examine yourself and you examine your breasts and get used to doing that and looking at the nooks and crannies and feeling for lumps. We've got 1 minute 40 seconds left, Claire. You finish off with what you want to say. And I know you've been really uncomfortable sitting there, and well done. And your story, like Emma's and Claire's and everyone else, is just truly awful. And I wish you all the best luck in the world. So carry on.
Thank you. Yeah, it is quite painful sitting here at the minute. It's been going on for about 6 months now, so I knew I had to get it checked out. Unfortunately, it has got a bit bigger. It's not necessarily looking great, but it doesn't necessarily mean it is cancer, but it's worth getting it checked out anyway. So yeah, my basic thing really is make sure you check your vulva, know the symptoms, look into these conditions that can affect the vulva and the vagina, know the symptoms for them. Keep a diary every time you check yourself as well. You know, use a mirror to check yourself. Write down anything that isn't normal for you, and you know, take that in and get it looked at, get it investigated. It could be that it's nothing, it could be that it's something, but better to take the chance on it, you know, on a result coming back, I think, than...
Okay, well, that's great. I'm glad I can do these. You know, if it helps a few hundred, I know medics watch them as well. So what I will say is always, when I save this video, none of the questions will be here. So if you want to go back, then go back to the video and write any questions in, because it may help people. And then my next talk is on Tuesday with Sam Evans, Sam of Sam Talks Sex. So I think that's going to give you a really good idea what that one's about. So I'm going to have to say bye now, Emma, and thank you very much. And this will be up in a few minutes. Thank you.
Okay, I'll see you later.
Bye-bye.
Bye.